My mom was a Wonder Woman. And I know she's in a better place.
Calvin Norman's mom, Ella, was one of 6 Skyline Nursing Center residents to die from COVID-19. More than 80 got infected, so we wanted to know how nursing homes like Skyline did on infection control. We showed Calvin a copy of a 100-page inspection report that we got from the state through an open records request.
No, I really didn't think it was going to be that bad, but after reading all of the report, it was much worse than I ever thought it could have been.
Regulators arrived at the facility in late April, about 2 weeks after Calvin's 83-year-old mother had passed. The report found numerous infection control deficiencies. Employees not wearing proper personal protective equipment, workers failing to isolate COVID-19 positive residents from those that had tested negative. A COVID positive resident was surprised to learn her roommate had tested negative because she thought her roommate had tested positive since the two had remained roommates.
The administration staff knew who was positive and negative and still put them together. That to me is an abomination because that is where people get sick and they die.
The report cites the CDC's guidance. It says if the resident is confirmed to have COVID-19, they should be transferred to the designated COVID-19 care unit. Skyline officials did not return our repeated requests for comment. Regulators imposed a civil monetary penalty on Skyline of $41,470 for infection control deficiencies. But we were surprised to find that Skyline received a $112,000 payment for doing well on infection control in December. The facility received the money from a $2 billion nursing home quality incentive program created to help nursing homes during the pandemic. 2 things to note: nursing homes didn't need to apply to get the money. They also didn't have to repay it. We wanted to see how many Texas nursing homes fined for infection control deficiencies also got these payments. Our analysis shows 268 Texas nursing homes have been fined since January 2020 for infection control deficiencies. But 210 of those nursing homes received quality incentive payments that covered, or often more than covered, the cost of those fines.
So how many people in the performance of their job get a bonus for doing a terrible job? The nursing homes are obviously do.
A Health Resources and Services Administration spokesperson told us those quality incentive payments are based on how well a facility did in a given month on their rate of infection and rate of mortality. Now here's what that means. If a facility does well in a particular month, they get the quality incentive payment, regardless of what occurred in other months.
Revisionist history, forget everything that happened in the early days of the pandemic and then what's happened afterwards.
Brentwood Place 1 was the site of another deadly outbreak. 14 residents died, and state records show more than 80 residents got COVID-19.
They give us no masks, no gloves, nothing like that.
This is a former employee describing the situation. She asked that we conceal her identity.
They had so many deaths because they didn't take the right precautions.
We asked the state for Brentwood Place 1's infection control report. What we received backs up many of her concerns. It says state regulators arrived at the facility in late April and early May, months into the pandemic. Inspectors found the facility failed to track infections of COVID-19 to prevent the spread of infections. The report also says a supervisor told inspectors that staff members wear the same protective equipment all shift because everyone in the building was presumed positive.
What that ends up resulting in is that everyone ultimately will be COVID positive in your facility because you're not abiding by infection control guidelines that had been in place for decades.
The facility received fines totaling $104,000 in July and September. Brentwood Place 1 also was a recipient of those quality incentive payments. It received payments totaling $351,000 for doing well on infection control between September and December. Brentwood officials did not return our requests for comment.
So we've been finding that facilities that have gotten these bonus payments have had serious outbreaks where a lot of people have died, and it's not just in Texas, but across the country this has happened.
behind the numbers, there are the faces of those who have died in our nation's nursing homes, people like Ella Norman. April will mark a year since she died, a grim milestone for her only child.
And the people who supposed to have been there to take care of her didn't take care of her. They didn't have a plan for them to have in place for something like this.
In Dallas, I'm Tanya Iser.